There are cases that the tongue cannot go to the roof of the mouth because the tongue is tight. The lingual frenum is too tight. So when you see this restriction, when you put the fingers in the mouth and you try to elevate the tongue, you are gonna see that the tongue cannot go to the roof of the mouth. So the patient has to close the mouth to be able to bring the tongue to the roof of the mouth. So you see the tightness of the lingual frenum, and we need to do the frenectomy. So we can address those cases by doing the frenectomy. In Aurora Kids Dentistry, we have the CO2 laser, which is one of the latest version of the laser to do the frenectomy. And you can see that we can do the frenectomy just with topical anesthesia. We don't need to use needles, which is a great advantage for the kids. We don't have the risk of bleeding, so we don't have to put the stitches. And we do all the myofunctional therapy program to regain the function of the tongue and the dynamics of the tongue, so we can start performing all the dynamics of the tongue with no restriction, and at the same time that we are correcting the malocclusion. In this case, we are also correcting all the dynamics of the tongue. So the child comes to a permanent dentition with no problems. So it's a child that later doesn't need a phase 2 treatment, but we did an early intervention and correcting also the restriction of the tongue because the lingual frenum. So we corrected everything for this patient. So you can see the change and development of the dental arch, how it becomes wider because now the tongue is able to sit on the roof of the mouth and permit and help the child to develop in a better way.